October 15th is National Latino AIDS Awareness Day. Although raising awareness of HIV and AIDS is a public health issue for the entire Latino community, it is of critical importance among Latino gay and bisexual men.
HIV STD program at the Texas Department of State Health Services. And today we'll be discussing HIV prevention issues facing Latino gay and bisexual men with Larry Cuellar, who also works for our program. Hey, Larry.
Hey, Janina.
Larry, tell me, how is HIV affecting gay and bisexual Latino men in Texas?
Okay, our recent data shows that among Latino men living with HIV and AIDS in Texas, the majority of them indicated that they were infected with the virus by having sex with another male. Young, gay, and bisexual men in our community have been hit especially hard. Over half of Latinos that receive a new HIV diagnosis in Texas were under the age of 35.
Wow. I understand that there is also a problem with late HIV diagnosis.
Right. What a late diagnosis means is that a person is diagnosed with AIDS within 12 months of their HIV diagnosis. What this means is this person probably had HIV for quite a while and didn't know it. Mm-hmm. And they also weren't aware that they can pass it on to other individuals.
I see. I understand that Latinos in Texas are much more likely to be diagnosed later than non-Latinos.
That's correct. Based on new HIV diagnoses in Texas, Latinos were more likely than other groups to receive a late diagnosis. About 45% of Latinos got a late diagnosis, when you compare that to about 32% for white and black. And this disparity was even greater for Latino men. About half of Latino men were diagnosed with AIDS within 12 months of their HIV diagnosis. So clearly we need to do a better job with getting Latino men to test early.
Yes. So what about access to care amongst people with HIV?
Well, Janina, as you know, access to care is an issue that affects many populations. Our recent data shows that 1 out of 3 Texans that are living with HIV have no evidence of access to medical care. Men are just slightly a bit higher to not be in care than women.
I see. What gets in the way of our community getting into care?
Well, I think there are many factors. Usually when a person is feeling well, they're not thinking about accessing medical care. Substance abuse can also play a part in affecting people's access to care. Lack of insurance, lack of resources, poverty, all of these can affect how people access care. And oftentimes many people are unaware of the low-cost care that's available within their community. And it must be noted as well that Texas does have the highest rate of uninsured people in the United States. And unfortunately in Texas there are fewer Latinos who have insurance when you compare those to whites and blacks.
Does poverty add to the challenges experienced by Latinos in Texas?
Absolutely. Like I stated before, there are more Latinos living below the poverty level in Texas when you compare those to non-Latinos.
So how many more Latinos in Texas live in poverty?
Well, there's approximately 74% of Latinos living below the poverty level. When you compare that to about 63% for blacks and 36% for whites. And as we know, when a person is struggling to get their basic needs met, like food and shelter, they're less likely to take care of their medical care needs.
What is going on with our Latino community that prevent them from getting into care?
Well, there aren't any easy answers, but we know that concern and fear regarding immigration status may play a part in having people access care in our community. Even though there are confidentiality policies in effect regarding accessing care and HIV status. Also, like other gay and bisexual men, Latino men who have sex with men may be closeted and not open about their sexual orientation. And like all people, they fear rejection by those close to them. And this can create a barrier to both treatment and to testing.
Yeah. So what will it take to prevent new cases of HIV in our Latino community?
First off, and more importantly, we need to make sure that our community gets tested so that they're aware of their HIV status. Second, they need to access the care that's available within our community if they need to.
I see. Well, thank you, Larry, for talking to us today.
Thank you, Janina.
For more information on HIV or National Latino AIDS Awareness Day, go to the following websites. To find out where you can get HIV testing and treatment in your community, call 211.